All right, good morning and welcome back. If you get caught up in traffic, because a lot of you are getting ready to leave the house, you might just have to clench your jaw to deal with the traffic situation. Now, do that enough, you might get a headache from it. I want to show you something. Here are the muscles that make your jaw open and close, but stress, grinding your teeth, and improper jaw alignment might make those muscles tighten up, causing a whopping headache. Well, Dr. Scott Wagner with Jacksonville Exceptional Dentistry is here to talk more about what he sees in his practice, and he brought along a human guinea pig. Good morning to you, Dr. Wagner. Who is your friend here?
This is Cara. This is my hygienist.
This is your hygienist, yes. Cara, I'm sorry you make your TV debut with this on. What is she wearing?
This is actually all the equipment that goes with my K7 computer, and what it really does is this is a sensor array with a little magnet in here, so it helps me track her jaw muscles and the position of her jaw. All these little connections around here evaluate the muscles and the electrical activity of those muscles.
Now, is this like electrical stimulation to her? Because I see her jaw is jumping.
Now, her jaw is pulsing. That's actually a TENS unit, and that's what, when we bring patients in who have pain, oftentimes you've got to break the pain cycle. In order to break the pain cycle, to find a most relaxed muscle position, we use a TENS unit, and it actually stimulates a nerve deep in the tissue, and it causes the muscles to pulse. It brings in oxygen, it brings in new blood flow, it breaks pain cycles, and that allows the muscles to relax. Now,
is this painful right now?
This is not painful.
Okay.
It's just one of those things that feels like it's pulsing. It feels like somebody's stimulating your nerve.
Okay.
Or your muscle, I should say. So
a lot of people grind their teeth, and it can cause some pain. We've got some pictures of what grinded teeth look like. If we could take a look at some of those. This one doesn't look so bad.
Well, exactly. That's the point of what we wanted to bring in, talk about today, is it's not just pain patients that have to suffer here, but actually this one is the type of patient that comes in that doesn't show a lot of wear. They don't have lots of damage to their teeth. Now, this particular patient had some crowns done in the back, but for the last 9 years, this patient has suffered from migraines. So this isn't something that's typically thought about as being a dental problem.
Sure, no.
And today we have the technology to evaluate the muscles, because it's really the source of the problem. Now, this patient that we're seeing right here, this is actually somebody who has no pain whatsoever. And there's a great number of people that are out there that have lots of wear like this. This is somebody who's cracking and breaking teeth left and right. They haven't had tons of dental work. They've had an extraction on their lower right side, but lots of wear, but no pain.
Which is ironic. And then finally, this is severe wear.
This is a combination where somebody who's had a lot of crowns, a lot of dental work. They even had some bridges in the back, but this is a classic situation. You've got a broken tooth in the lower front. If you even look at the upper teeth, there's like a little a lot of wear up there on the canine and the premolar. That's just not a healthy bite.
Did this person have pain?
This person had no pain.
Okay, so it just goes to show you can have very little showing of your teeth, however, have the pain associated with it. The animation one more time again, where your jaw muscle opens and closes. What is that showing us right here?
This is just an example of the muscles that are being activated or in use for the most part when somebody's functioning. The part that goes up the side of the head is what we call the temporalis. The one that's on the side of the jaw right there is called the masseter muscle. And if you look on Cara right here, I've actually got a couple leads on either side for each of the muscles. And if we, on the next part, if we're able to go to the computer, I can show you where those muscles are actually evaluated by my computer. And the goal is to find the most relaxed position. If you can get them relaxed, you can get them calm, you can get them healthy, you can break pain cycles, and really get somebody like Cara was an example patient, and she had problems not with any wear, but she had pain, she had jaw pain, she was cracking and breaking teeth, root canals, all those kinds of things. And we've done a workup on Cara and gotten her in what we call a bite split, and that's one of the ways we...
Yeah, and we're going to take a look at that workup that you've done. Dr. Wagner will go more in depth coming up later on the show with the tensing machine. He's going to tell us how tense we become and the effect it's got. All right, thank you, and you're going to come back just like this, right?
That's right.
Okay, poor thing. The 47, as promised, Dr. Scott Wagner is back with Cara. He is demonstrating a tensing machine. So people come into you and say, you know what, I get these terrible migraines. Oftentimes, you think it can be diagnosed to their jaw?
Well, actually, 80% of all head and neck muscle is actually muscle pain. So oftentimes, when people come in and they've got, oh, I've got TMJ, It's this kind of catch-all phrase that fits in into dentistry today, and it's one of those things where we can now diagnose it. We've got the technology, we've got the computers, we've got the research, and now we can get her car in this example or other patients to a really comfortable position. So
okay, so let me get this right.
Yes.
So I come in with migraine pain, and one of the ways you can make sure, I mean, there's a way to either rule out or rule in jaw pain.
Well, first, if somebody comes in with migraines, they've got to get it cleared by their neurologist that they don't have a tumor, they don't have some other major physiological problem going on. After they're cleared from that side, I can then see them and 90% of the time rule it out whether it's a dental problem or not.
Great. So that gives people just a little bit more direction in which to proceed.
Sure.
All right, now you have run the test on Cara. You have got an example right here on your computer, not of Cara, but of somebody else. And show me what we're looking at right there.
Well, on your left side of your screen, what you've got is somebody you presented to me with real severe wear. This is actually a non-pain patient, but they would clench and grind. Now, this is them putting their teeth lightly together, and what these lines mean is it's each individual muscle group. It's kind of hard to see on the TV, but if you look to the right side, you can see a very different level. It reads like a Richter scale for earthquakes.
Sure,
The bigger the lines, the more hyperactive the muscle, the more uncomfortable it is. Well, this patient was clenching and grinding. We got them to the point where, if you look on the right side over here, you can see these muscles are calm, they're relaxed. That's what the smaller lines represent.
And a bite guard oftentimes helps people reach that relaxed state. Is that correct?
Well, in neuromuscular dentistry, we don't use a standard bite guard. We use something called an orthotic. Now, you're familiar with orthotics for your shoes?
Sure.
It's a repositioning device. Well, what we're trying to do is find a new position for Cara's jaw, and it's a jaw repositioning device. It actually is anatomical, so when you bite, you feel like you've got a home position. You can't just slide all over the place like a lot of the standard night guards that are normally given for people who clench and grind.
This is good information for a lot of you who get those migraines and your doctor has ruled out all else.